be sharing Mommy's tips for health and wellness.
Hello everyone, my name is May and let me share with you my health and wellness journey. First of all, let me say a few things about myself. I am 34 years old, I am married, I already have a daughter, I am a nurse, and I am an endometriosis patient. My videos are for women who have endometriosis, polycystic ovaries, and other reproductive issues. And most of all, it is meant to give information, motivate myself and my viewers, and to give support. So for our topic for today, we will talk about how did I discover that I have endometriosis. The first time I felt that there is something wrong with me was 7 years ago when I was 28 years old. This was a time that I had a massive bleeding. Hindi siya miscarriage, hindi rin siya regular menstruation period, but it is a kind of bleeding na hindi kaya ng pads. Like I had to use 3 diapers a day and medications to stop the bleeding. So after that, I was in bed rest for 3 days. So I consulted a doctor at Asian Hospital Medical Center, and I was with this doctor for 4 years. So we had several tests like ultrasounds and series of pelvic exams. So what we found 7 years ago is polycystic ovaries. So yun lang yung case ko 7 years ago. So when I was having that bleeding, sabi nila raspa na usual nating naririnig. But my doctor that time sa Asian did not recommend me to have that kind of procedure. So 4 years ako sa kanya. So after that 4 years, doon na nag-start na naka-feel ako ng pain. Well, when we talk about endometriosis, if you try to Google it, basically, it will discuss about pain during menstrual period. So, pain talaga yung number 1 problem with endometriosis. So, in my case, it's not the usual pain. When you say you have dysmenorrhea, whenever you have menstruation, tolerable siya. So, in my case, it's like, for example, given a pain scale of 0 to 10, mostly you will feel 6 to 8, ganyan, tolerable na sa akin yon. But there are times na 10. Actually, last week, 10 talaga yung pain scale ko with my last menstrual period. So, ganun siya. If it is endometriosis, it is basically pain. Pain during menstruation is usually called dysmenorrhea. But in our case, in endometriosis, the pain is usually very severe sa lower back or the whole pelvic area. Yung iba sa sciatic nerve area. Maybe I can show pictures for those na gusto pang makarelate or those na nakaka-relate with the site of pain. And usually, yun talaga yung nararamdaman ng isang may endometriosis. So as I was saying earlier, ito yung pain na hindi ka makakatayo or hindi siya simpleng dysmenorrhea. It is something very bothering na hindi ka makabangon, and as I said, hindi ako maka-lie flat on bed pag natutulog ako na nakadapa. So this is really something na the kind of pain that will really make you see a doctor. So from my doctor sa Asian Hospital for 4 years, sa Asian Hospital ako. After 4 years, I went to St. Luke's BGC for another doctor. Then that same year, I went to UniHealth Paranaque, which is near my place. So that's another OB-GYN when I was 32. And then after a year, 33 onwards, I stayed with this one doctor from Manila Doctors and MAMC or Manila Adventist Medical Center. So I had several doctors to see me and trying to look for a doctor who can really handle my case well. So, after several doctors, I was officially diagnosed as endometriosis patient when I was 32 through series of ultrasound, of course, and pelvic exams. eventually, doing these exams, marami pa silang ibang nakita. Like for example, I also have polycystic ovaries. So, yung PCOS na usual natin naririnig, very usual yan. Also, I had myoma and adenomyosis. So, all these conditions were diagnosed all throughout the procedures that I have been doing. So, having that said, for the last 7 years, when I started to feeling not so well, I was diagnosed 3 years ago with, endometriosis. So guys, if there are some of you who are feeling the same kind of pain, something that you cannot tolerate anymore, it might not be a usual dysmenorrhea. So please see a doctor if you are feeling that kind of pain already. Also, please be informed that endometriosis or this kind of pain is a reproductive issue that you can manage. It can be managed and you can always ask for help. So, huwag kayong mag-worry, kailangan nyo lang magpa-check. And then, for those naman na may endometriosis na and hindi kayo masyadong regular na pumupunta sa doctor, you might also be asking ano kaya yung tinitake ko for pain. Please also be informed that pain management or pain medication is different from one person to another. So like for example, sa case ko, I have severe gastritis also. So, hindi ako pwede sa NSAIDs na mga gamot or the non-steroidal anti-inflammatory drugs. So, hindi ako pwedeng mag-take nun, ibang klaseng medication yung tinitake ko. So, iba-iba siya. So, it is best to see a doctor and wag po tayong mag-self-medicate. It is always best to see your doctor or your OB-GYN. We were talking about pain medications, pag-inom ng medicines for pain. But one tip that I will be sharing with you is the use of hot compress. So yung hot compress natin, this one is very effective. Kahit hindi, even if you do not have endometriosis and you have muscle pain, this one you can use to relieve your pain. Always remember na hindi dapat tayo inom lang lagi ng gamot. We should also find ways natural ways to alleviate the pain. So, we just put this, you regulate the heat and put it at the site kung saan mo gustong i-relieve yung sarili mo of pain and you will feel comfort then afterwards. So, itong hot compress na to, best friend ko na to, ilang taon ko na tong kasama. So, guys, always remember, health is wealth. Sabi nga nila, mahal magkasakit, pero mas mahal ang malalang sakit. So, please see a doctor if you feel something different in your body. So, I hope you learned something from this video. Please like and subscribe for those na gusto pang mapanood yung mga next videos ko about reproductive health and other health and wellness tips. So, ito yung mga topics na pwede nyong abangan sa ating next videos. So, we will be talking about what is endometriosis and who are at risk of having endometriosis. And of course, what are ways to manage endometriosis. So, see you!